New concerns tonight after an inmate at a Connecticut prison died from COVID-19. Critics say the Department of Correction is not doing enough to prevent the virus from spreading inside prisons. Channel 3 Eyewitness News reporter Mike Savino is live from outside Hartford Correctional Center. And Mike, what do they want to see here?
Well, Aaron, and it's not just that death on Wednesday. There was also a surge of cases here at the Hartford Correctional Center just a couple of weeks ago, and now some other facilities are also seeing their numbers go up. So these critics want to see a number of changes, starting with a release, of more inmates.
And these are deaths that are completely preventable.
Wednesday's death of an inmate due to the coronavirus is reigniting calls for a better pandemic response from the DOC. And demand number one from critics is for the release of more inmates. The DOC describes the inmate as a 45-year-old male who was transferred to a hospital on October 15th for treatment. The person was sentenced to 3 years in jail for burglary and strangulation and wasn't eligible for parole until May. But advocates for releasing inmates say people with medical conditions and those awaiting trial should be released.
There are large numbers of people that could be released in relative short order if there was the will to do so.
The prison population is down 3,100 inmates since the start of the pandemic. A DOC spokesman says this allows for social distancing within housing units, again helping to mitigate the spread. And the DOC says it's taking more steps, including more frequent cleanings. This week, some facilities will offer video visitations, and inmates are tested at intake, before transfers or outside medical appointments, and if they show symptoms. The DOC employee unions back the agency, but ask that all in-person visits be suspended like they were in the spring.
DOC facilities can be a vector for the virus, just like nursing homes can.
But critics point to increases in cases. Hartford Correctional saw positive tests jump from 56 to 109 over the second half of October. Over the last 2 weeks, McDougall, Walker, and its infirmary, as well as Osborne Correctional, have all seen rises. And the ACLU says the DOC is not meeting a settlement the two sides reached this summer, including mask wearing by staff and inmates, giving soap to inmates, cleaning, and quarantine people with the virus. DOC just recently completed a third round of testing, including 8,600 inmates. They had a positivity rate of less than 1%. Live from Hartford, Mike Savino, Channel 3 Eyewitness News.